Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Respiratory Issues in the Older Adult, Episode 1, the Respiratory System. After viewing this episode, participants will review the function of the respiratory system. Participants will review the changes that occur in the respiratory system associated with the aging process. Participants will review components of the respiratory exam, and finally, participants will review respiratory therapy.
So the basic function of the respiratory system is really to perform two tasks. One is to oxygenate and the other is to ventilate. Oxygenation means you take oxygen from the room air and put it into the bloodstream. And ventilation is simply to take carbon dioxide, which is created by the cells in the body, and to excrete it through the lungs.
The respiratory system with age does decline. There are several reasons it declines. Number one, the connective tissue as we age tends to get less elastic, so that the airways aren't pulled open as far and they tend to get narrower. The other part is the sacs in the lung, the alveolar sacs tend to get shallower. The muscular system tends to decline. And so the strength of the diaphragm and the intercostal muscles that are connected to the ribs decreases. So that accounts for the decline in age-associated lung function.
Aging of the respiratory system is just like aging on every other organ system. In essence, nothing really gets better. There's a host of things that change with age. The lungs become a little less efficient in their ability to do gas exchange, again, oxygenation and ventilation. There's some weakening of the respiratory muscles, and there's a decline in the general ability to defend against infections. The lung has a lot of innate immunity, and as people age, they become more susceptible to pneumonias and other lung infections. Well, these age-related changes seldom lead to a significant change in symptoms, but they do contribute to an older person's inability to exercise with the same vigor that he did as a younger adult. There's also this higher risk of bacterial or viral infections as one ages.
The primary function of the respiratory system is for gas exchange from the environment to the bloodstream. With age, the respiratory system becomes less efficient due to anatomical and physiological changes. Changes include decreased efficiency in gas exchange, decreased muscular strength, changes in the alveolar sacs, and decreased ability to fight infection.
With geriatric patients, the first thing I do is look at the whole person and see how much distress they look like they're in.
There are four major components to the respiratory physical exam. Number one is inspection. Number two is palpation. Number three is percussion. And number four, which everybody jumps to, is auscultation, meaning listening to the lungs. Inspection typically implies just looking at the chest. Are they using a lot of their accessory muscles to breathe? Is there some paradoxical motion of the chest and the abdomen? The palpation part is basically laying hands on the chest. You look for any evidence of subcutaneous emphysema, which is when air leaks out of the normal air sacs. And you palpate for the normal movements of the chest, looking for symmetry. The percussion is really just laying your hands on the chest and percussing it like you would a drum in essence, and looking for is there evidence of consolidation, which would be manifest as hearing dullness, or is there hyperresonance, which is typically implies air trapping or advanced airway disease. And then finally, auscultation, meaning listening to the lung with a stethoscope, or sometimes just with your ears. You're listening for sounds such as stridor, which is one of those sounds you seldom forget. And you listen for wheezes or rails. Wheezes or wheezing typically implies some airway narrowing. It's a continuous lung sound, which is musical in nature. And rails are discontinuous lung sounds, and there are many types of rails, and sometimes people even use the word crackles, which which is the same as rales. They're both discontinuous lung sounds. And these typically imply some abnormality in either the airway or the lung parenchyma.
Before you begin your focus exam, view the entire patient for signs of distress. The 4 points of assessment for the respiratory system include inspection, palpation, percussion, and auscultation.
Capnography, what is it? It's basically a word for carbon dioxide monitoring in the exhaled breath. It implies one of two ways to measure carbon dioxide. It can be done in graph form, where you actually graph out the carbon dioxide that's exhaled in a breath, or it can be done in a simple number form, which is the actual measure of the carbon dioxide at the very end of an exhaled breath. One is referred to as capnography, when you actually graph it, and capnometry, which you actually produce a number. Now, there are other ways in which we categorize carbon dioxide monitoring. One is qualitative, saying, is there carbon dioxide that you're measuring? And the other is quantitative, which is how much carbon dioxide is there. When you think about carbon dioxide, especially in the pre-hospital setting, I think what people care about the most is have you successfully placed an airway or a artificial airway, meaning an endotracheal tube, and we use this calorimetric device, which is a simple color change, which tells you that you have placed the airway into the trachea. There are other things that we use in the pulmonary world to measure carbon dioxide because it can tell us other bits of information. It can tell us something about the metabolism of the patient. It tells us something about the perfusion of the lungs themselves, and also gives us some data regarding the efficiency of the lung in ventilation.
Capnography measures the concentration or partial pressure of carbon dioxide. It is used in EMS to ensure placement of advanced airways and continuously monitor artificial ventilation. Colorimetric devices are still used by some EMS agencies. However, wave-forward capnography is more accurate and becoming standard of care.
CPAP is, in essence, a continuous positive airway pressure. It's typically applied non-invasively, meaning that this is a machine that applies one pressure that you determine, the physician or the care provider, and it's typically applied via a mask, although there are many different interfaces. There are masks that cover the nose and the mouth, and I think that's probably most common in emergency rooms and pre-hospital care, as well as in inpatients. And what they do is they stent airways open. That's probably the most common application, especially in people with chronic sleep apnea, obstructive sleep apnea. But in pre-hospital care and in inpatients, we use it for a number of different medical conditions. It has been shown to be beneficial in patients with pulmonary edema, especially flash pulmonary edema. And it can actually help oxygenate people with hypoxic respiratory failure of a number of causes.
The using of CPAP or BiPAP in an elderly patient, the number one thing to remember is to never use it on an obtunded or unconscious patient, because they can fall off and you would have no warning. The other part is that they need moisture in the air that's being circulated there, because they already have difficulty in clearing their secretions. If you use dry air, that will only become more difficult for them.
CPAP stands for Continuous Positive Airway Pressure. It is intended to stent airways and help patients with CHF and flash pulmonary edema. Never used on an unconscious patient, and moisture in the air surrounding CPAP is better than dry air. Respiratory distress as the result of an existing medical condition has a variety of therapies depending on the severity and symptoms. Treatment for respiratory distress or exacerbation in the field includes proper positioning of the patient, supplemental O2, bronchodilators, CPAP, and/or artificial ventilation. Examples of bronchodilators include beta-2 agonists, albuterol, and anticholinergics, Atrovent. After viewing this episode, participants will review the function of the respiratory system. Participants will review the changes that occur in the respiratory system associated with the aging process. Participants will review components of the respiratory exam, and finally, participants will review respiratory therapies.